Welcome, everyone, to the Rural Mental Health Learning Community and our webinar today on conversations on redesigning the educational system to support children in poverty in rural areas. We're really excited to have this conversation, and we really appreciate each one of you joining us here today. I'm going to start with a little bit of housekeeping. As you know, this learning community and these webinars have been hosted by the National TA Network for Children's Behavioral Health, supported by a contract from the Substance Abuse Mental Health Services Administration. That contract is ending on November the 7th of this year. So unfortunately, this is going to be the last time we are convening this group. We've certainly enjoyed the past almost 4 years with you all and really want to look forward to continuing to stay in touch, even though this Rural Learning Community will not be formally convening anymore for the foreseeable future. Our contact information is all here, who have been leading the community for the past several years. It's myself, Shannon Robshaw, Christina Paternoster, who's the family lead, and Matt Buckman, who's our clinical lead, and then Sarah Warner, who's providing us with all sorts of support. So we encourage you to stay in touch with us going forward. We are working with the System of Care Leadership Learning Community to try to work with them to roll in some rural considerations as they move forward and they continue to convene and work together. That's going to be part of a subscription process. As we're moving out of this contract with SAMHSA, we're going to be providing more direct contracting with individual organizations and states. So there's different ways to do that, but there will be a subscription available if you choose to participate in this System of Care Leadership Learning Community, and we are going to try to, again, get some rural considerations considered there. So if you do have some thoughts about what you would think the priorities might be for those rural priorities within that leadership learning community, we would welcome your thoughts on that. And so please email myself, Christina, or Matt, or Sarah with those thoughts. Additionally, the content that has been produced during that TA Network contract with SAMHSA through the rural learning community, as well as all the other learning communities that the TA Network hosts, will still be available publicly with no subscription. And so you can get to that. Sarah's just posted the website in the chat box. It's myabsorb.com. It's Ideas at the Institute, and the link is theinstitute.myabsorb.com #public/dashboard. But the link is right there, so click on it. For those of you in the past that have used that platform, we've asked you to make a login and create a login account and a passcode. That will not be necessary anymore going forward on the public page. You can just click right on it and look around and find whatever you need. This presentation and recording will also be housed there, as well as any other resources that we provide or that you want to provide to us to provide on that platform going forward, to be available to everyone publicly for free. And so the rural learning community and all the other learning communities, all their content up through September 7th of this year will be available publicly. If you want to get access to the new content that continues through the leadership learning community or any others that we are going to be developing, that will be, again, through a subscription process. The best way to keep up with opportunities through the TA Network going forward, whether it's subscription or otherwise, will be through a subscription to a free subscription, let me put it that way, the TA Telegram, which has been a weekly electronic newsletter. It probably will be dropping to every 2 weeks or once a month, something like that. Probably not continue it every week, but that again is free, and it's the best source to kind of keep up with what's going on and things that we are promoting, not just that we're producing ourselves, but things that we think the field would benefit from knowing about, other resources from other organizations. So that would be a way to kind of keep up And hopefully we'll be able to have some rural content provided there as well. So again, if you have some recommendations about key topics or resources that you want to continue to make available to this learning community, please, forward them to us, and we will do our best to either get them out to the group directly, put them on the learning platform, or get them in the TA Telegram. Okay, so welcome. Let's try and find out. As we usually do, we like to know who is with us today. So let's do a couple of polls. We could start the poll, Sarah, and find out what role each of you play today. And please scroll down, because in your chat, this is in the chat box. So if you move your cursor across the bottom of your screen, you'll see a series of circles. One looks like a chat bubble. Click on that, and it'll pop up to the right-hand side of your screen. And then scroll down, because there are other choices. There's beyond what just first pops up. So the first question is, my role can best be described as. So pick whatever fits closest. And then the second question is, my organization can best be described as. And again, fit whatever you think is closest to what your organization does. And then that will help our presenters know who they're talking to today, talking with, and be able to tailor their content a little more specifically. So I'm going to give just like a few more, like maybe 30 more seconds, I think, since we have 2 questions, and let folks get their answers in. Last count, I think we had 108 people registered. I'm not sure how many people have actually signed on, but probably about half, I would guess, if I had to venture a guess. So really hope y'all will chime in here so we know who we're talking with. All right, Sarah, I think that's probably long enough. Okay, let's see. So what we've got is lots of family support providers. That's terrific. We have, well, most of y'all didn't answer, so I really hope if we go forward, you will be more engaged and let us know who you are and answer other questions that I know our presenters are going to be posing. So at this point, we have 43 people signed on, 20 of which did answer. We have technical assistance providers, direct service providers, family support providers, executive leadership, project directors of system of care grants, and the types of organizations, private providers, mental health organizations, state, tribal, territory, mental health agencies, education agencies. We've got 4 education agencies represented here. Philanthropic organizations, family organizations, others. Okay, great. All right, well, let's close the polling, and we can reopen the chat. If you just click on the chat little button up by the chat, which was above the polling box, then your chat box will open back up. And then we can take questions and answers in that way as well. All right. So I think with that being said, now we have a little bit more information about who we've got here. I'm going to go ahead and turn it over to Matt Buckman, who's going to introduce the learning objectives and the content in our presentations, and then turn it over to the presenters. Thank you.
All right. Thank you, Shannon. And I'm very fortunate to be able to get to introduce MK Montgomery and Bridget Rodriguez from the Harvard Education Redesign Lab. I know today's Friday. I know it's Friday afternoon. A lot of us have, oftentimes we try to play these in the background. I will say that, this is going to be a very interesting topic. I think it's very timely given the needs that we've seen arise during COVID-19, and we're seeing disparities, and not everything is equal, right? That it's not hitting all communities the same. It's not hitting all socioeconomic backgrounds or racial backgrounds or ethnic backgrounds the same way. And so we're seeing our gaps get larger between different groups of people. Now today what we're going to do is we're going to talk about strategies and on reframing, reforming, redesigning the educational system specifically for youth that are in this group that experience more adversities and more disparities. This group of individuals that live in poverty and have less resources that maybe others might have. And Oftentimes, I grew up in Western Kentucky, and for me, we very much thought that we grew up poor, and we had less than other people did. But as I've worked in this field, more and more, I see individuals that have significant struggles that it's hard to really say that that this is the land of equality. That's probably harder to say as I've learned more and more. This is going to be an interesting conversation. I do hope that it's a conversation. We're going to all chat together during this time. I'm going to use the chat box. But Bridget and MK, they have a wealth of experience and knowledge and have worked with lots of communities and rural settings. And how do we be able to create the change that might be needed now more than ever for the students and the youth in our communities and our families? So without further ado, Bridget and MK, thank you guys very much today, and I'll turn it over to y'all.
Thank you so much, Matt and Shannon, for inviting us here today, and it really is a pleasure to be with all of you. MK is going to start tap dancing to keep you engaged on a Friday afternoon in the summer. I didn't tell you that, MK. We come here to share some of our work, but we also come here to learn from all of you. Working with rural communities is something that's a relatively new area of work for us at the Education Redesign Lab at the Harvard Graduate School of Ed. In the last couple of years, we're fortunate to have colleagues like MK and Matt to help us learn and to give us direction on resources and tools that would be useful to the field. But as Matt said, we really would love to be in as much of a conversation with you today as possible. So let me begin by just, I'll say a word of introduction about myself. I'm going to ask you all, as I'm doing that, if you wouldn't mind using the chat box just to share your name, your organization, where you're located, and a question or challenge that you're facing so that we can be thinking about that as we speak with you all today. And then I'm going to ask MK to introduce herself. And then we have a handout that we'd like to use to speak to as we're going through the presentation. So as we're waiting for folks to let us know who's here in the chat box and any challenges or questions you might have, let me first say a word about EdRedesign and my own background, and then we'll turn it to MK. So the Education Redesign Lab, we call it EdRedesign, as I said, is located at the Harvard Graduate School of Education, founded by our former Secretary of Education in Massachusetts, Paul Rebel, who in the last 6 years has joined the faculty at the Ed School. In Massachusetts, Paul was one of the chief proponents of education reform for the last 4 decades, really being a proponent of the curriculum and standards and accountability movement in Massachusetts that led some of the national trends around that work. And during that time, many necessary reforms that were brought to schools, as well as an infusion of quite a few state resources to support schools, so more money for school districts. That effort, as Paul will be the first to say, was necessary, but has not been sufficient. And I'll be sharing a little more about that in a minute. So the conclusion that Paul brought back to his position at Harvard, which is when he founded EdRedesign, was that schools aren't a strong enough lever to really achieve the goal that we all hold, which is to be able to support all students to be successful and thrive in school and in life. So with that in mind, he founded EdRedesign, which is really holds as its mission this idea that we need to support students holistically. Education, of course, is fundamental and important, but it needs to be integrated with health, behavioral and physical health, as well as out-of-school time activities. And all of that needs to be much more personalized, and it needs to be a community-based approach versus just thinking really about reforms to education. So that's the organization that MK and I are associated with. I'm the managing director there. The first half of my career was really spent in the classroom. I taught both in Los Angeles and California, Los Angeles, California, and Cambridge, Massachusetts. I was a elementary school principal. I worked in a couple mayor's offices, and then I went on to work with Paul when he worked at the state. So I bring a lot of years of on-the-ground experience to this work, and I know that as much as schools are a central and key and important component of the opportunities that we provide to kids, there's much more support that needs to be built around that as well. So with that in mind, I'm going to hand it to MK so she can introduce herself.
Thanks, Bridget. Hi, everyone. It's great to be with you this afternoon. Happy Friday. As Bridget said, I'm MK Montgomery. I'm the Rural Fieldwork Fellow for the Education Redesign Lab. So a bit about me. I'm actually from rural southeastern Missouri, so those folks from southern Illinois, basically neighbors. And I'm actually the daughter of a pediatrician, so a lot of my lens, most of my life growing up was through rural healthcare delivery for children. My interests are specifically at the intersection of educational inequity and health disparities. I'm a former classroom teacher. I have a master's in public health and then also a master's in education policy management. So I think a lot about the intersection of education and healthcare and policies that can improve outcomes for children more broadly.
Excellent. Okay. You didn't tell stories about going with your mom on home visits in the middle of the night to sick children.
Those are always great.
Yeah. Well, we're lucky to have MK working with us because of the lived experience that she's had, as well as what you just heard about her expertise, both in the areas of public health and education. So with that, what I want to do is, for folks, but we want to use it to speak to some of the main issues that we're thinking about. So if you click in the chat box, Sarah had posted the Google handout for us. I'm just going to walk through some of those. You'll see a picture of what I look like pre-quarantine. I'm wearing the same necklace, which is something funny about that. But let me start with number 3 in the handout. So as I said, a big part of what we are kind of fundamental idea at EdRedesign is that schools can't do it alone. And for many of us that work in the field of education, this quote from Horace Mann, education beyond all other devices is human origin, it's the great equalizer for the conditions of men in the balance wheel of social machinery.
Bridget, I'm sorry to, but can we pause you? Your audio is somehow breaking up a little bit. You were fine at the very beginning, but when you took it back from MK, we're having trouble hearing you. I don't know if you can reposition your microphone, or Sarah, do you have a different idea?
Is that any better?
Yes, that's a lot better. Thank you.
Okay. All right. I'll hold the mic here. Thank you for letting me know. Okay. So this quote from Horace Mann is one that many of us that entered the field of education really brought us to the field and kind of drive our commitment to kids. And what we have found through the years of looking at what's happened in reform in Massachusetts and nationally is that while it is of utmost importance, it has not been the equalizer, as Matt said, in our country as currently constructed. So our work really is trying to think about what needs to be integrated with education, what additional pieces of community supports need to be aligned and coordinated with the field of education to really achieve the goal that we all have of providing all our kids in a way.
Hi, Bridget. I'm so sorry to interrupt you again. It seems like we're still having issues with audio. I think we might, are you available to call into the audio with a cell phone?
Yeah. Yes.
Okay, I'm happy to work on that process. Thank you everyone so much for being patient with us while we get this sorted. It's a Friday for technology as well, I guess. Okay. Bridget, if you go up to the top menu, there is an option that says Communicate. if you click on that, the first option then is audio connection. Once you click on that, then let me know.
I don't see that, but
it's all the way at the, okay.
Yeah, I'm going to call in from my cell phone. MK, do you want to maybe move ahead a little bit and talk about a few of the rural pieces while I'm getting myself set up?
Sure, I can definitely do that. Can everyone hear me? Yeah, okay. So Bridget was just on what looks like slide 4 in the handout. She was moving on from the quote from Horace Mann and moving into some of the growing inequality, and I'll let her speak to that a little bit. But if you can scroll down through your handout a bit, through the slides if they're numbered for you, and you'll get to one that it looks like it says what is rural, and there's a map of the U.S. and it has a big statistic in the middle. It says 72%. That is slide 57, if you're able to see that through. So I'll go ahead and start talking a little bit about this. So really important to the Redesign Lab is thinking about specifically what's happening for children in rural parts of this country. So as many of you I'm sure know, 72% of the geographical landscape of the United States is considered rural, defined by proximity to an urbanized center. What's interesting about that is that while 72% of the geographic landscape is considered or classified as rural, the population in rural areas is about 1/5 of the U.S. population. And it's a pretty staggering statistic when you think about 1/5 of the U.S. population living in rural areas, especially when you think about this juxtaposed in education, where oftentimes policy focuses on a more urban center. And so when education and healthcare policies focus on more urban centers, they don't always capture the nuances that exist within a rural space. And what's kind of alarming is that there are more students in rural schools in the United States than the New York, Los Angeles, Chicago, and next 75 largest school districts combined. So when we think about policy that misses a huge swath of people who are a diverse and a population that we really need to be focusing on, when we make plans like we're currently doing with COVID-19 reentry plans, and we don't consider specific contexts of the rural counties that exist across the country, then we're really leaving out and doing a disservice to those folks. Bridget, I see that you're back on via call. Oh, I think you're muted.
Can folks hear me now?
Yeah.
Yes, we can.
Okay, I'm sorry about that. Do you want to hand it back to me, MK, or should we?
Yeah, that's great. I was giving a brief, I had people scroll all the way down to slide like 60 or something, giving a brief rural, but if you want to take it back over, if it's not too confusing, that's totally great.
Okay. Okay, so you just got a little preview of where we're headed. So I think where I left off, and hopefully folks heard me okay, is just this, we very much are working from a point of view, schools are important, but they are not sufficient to supporting the whole child. And what I'm going to share are a number of slides that just show some of the data nationally beyond just the rural areas, and we'll come back to those rural data pieces in just a minute with MK. But just to give kind of a more global picture, I have a few pieces of data I'd like to share with you. So the next slide, number 4, is about income inequality, which shouldn't be surprising to folks, but sometimes when you look at the actual data, it can be somewhat shocking. So this slide number 4 shows the growing income inequality, and that it's not even the 1%, but the 0.1% take in about 188 times as much as the bottom 90% of folks in our country. And we know that these income disparities interact and overlay with systemic racism. And in Massachusetts, we have this really shocking statistic recently that the median net income or net worth, of Black families is $8 in the Boston area, where as opposed to $247,000 for white families. And to kind of exacerbate the situation more, this issue of social mobility has just gotten worse. As you can see, since the 40s, it's just been a downward trend in terms of the percentage of kids earning more than their parents over time. And of course, we've heard about this in the media as well. And if we break this down and look at pathways to middle class, having to thinking about mobility, we know that the advantages accrue to certain demographics within our community more than others. And this next slide just shows that by different demographic groups and the top quartile in terms of income. So, as I alluded to earlier, our recent education reform as a country has really focused singularly on issues of school reform, about teaching practices and curriculum and standards and accountability, all of which, as I've said, we know are necessary but are not sufficient. And so our theory of action really is that we need to think about these issues of equity in a systems approach that really thinks about individuals holistically and not in a one-size-fits-all manner. This next slide just talks a bit about some of the reform strategies that we've used focused exclusively on schools. And as I said, in Massachusetts, our results on average have been excellent. So, if you look at slide number 11, you'll see from a span of 2007 to 2017, Massachusetts ranked #1 nationally, and we were often compared very favorably internationally. But if you go to the next slide in our deck, you'll see that once you disaggregate the statistics, we have not done well in terms of closing the opportunity and achievement gap. So all of those efforts, while important, and it looked like we were doing pretty well if you look just at the aggregate in Massachusetts, we know that we were not able to achieve the original goal of serving all kids well. And this is a trend that's true across the country. In addition to that, we've kind of seen nationally a plateauing of student outcomes over the last number of years, slight increases for the 90th percentile of students, but really a decrease for those in the bottom 10%. The next slide shows some research out of Stanford University from Professor Sean Reardon's group there that some of you may have seen, which is actually, I would recommend to everyone to take a look at their own locale. If you just Google Sean Reardon in the Center for Education Policy Analysis, you can find this interactive map, which shows sadly, the correlation between socioeconomic status and educational outcome. To the far left are poorer communities, to the far right are richer, and then the axis going up and down is grade levels above average and number of students below grade level, and the horizontal line going up to the right showing that correlation. The thing that is important to note here is that if you look at any one horizontal line, there are communities, and these are by communities, not just school districts, where a community is doing far better or far worse than the average. And so we know that schools and the services and supports that we provide students make a difference. So this correlation doesn't have to be so. If we think about what are the different kinds of best practices that communities are using to disrupt that association. The next slide shows some of the disparities in terms of attainment of bachelor's degrees and the way that these correlate to income. So you'll see that the top line there is the top quartile in terms of income and how closely that correlates with educational attainment in terms of post-high school degrees. The next is some more student achievement data that shows some of the stagnation that I was referring to before. But it's really these next couple of slides that I actually wanted to spend a minute looking at, actually beginning with slide. So 17 is looking at disparities by disability and language. So I'm sure that you've seen these in your own locales and are probably not surprising. The next ones are the ones where I actually think it helps us to understand that the 80% of children's waking hours that they spend outside of school account for a lot of the disparities and outcomes that we see for kids. So this slide number 18 shows the average SAT scores by family income level. And you'll see how closely those scores correlate to income versus any other single influence, which then translates to access, particularly at our most elite universities. So our own institution, Harvard here, 33% of those admitted are legacy admissions, so students for whom they had a parent or a close relative who was an alumni of Harvard, and then athletes, donors, and legacies combined total about 43%, which is close to half of students admitted have some one of those advantages coming into the process. And then the example from Princeton below shows the advantages accrued according to family income, top 20%. 72% of those students enrolled come from the top 20% of family income, and only 2% from the bottom 20%. So all of this data really points us to this conclusion, which I've mentioned before, which is that the reforms that we've seen to schools have been necessary, but they've been insufficient. There's this unfortunate, sad correlation between income and educational achievement and attainment, and that our schools as currently constructed really aren't a strong enough intervention alone to serve all of our students well. And we know that social capital, if you look at slide 21, and really the social capital that comes with the advantage that higher families in higher economic, socioeconomic brackets can accrue translates to opportunities and outcomes for kids in those income brackets that aren't available to others. And so our work really has been to think about how can we help communities think about creating systems of support to open up access to more in each of the communities that we've been working with and studying. I promise these data slides will end soon. I think I'm going to just move ahead to slide 23. Which makes the point that poverty matters. We have 1 in 8 of our Americans is officially poor, and the number for children is even higher. Nearly a third of our kids are classified as living in poverty. The reason that this is such an important piece is, as you can see in slide number 24, it really is one of the doors to access for out-of-school time extracurriculars. This slide number 24 shows the spending gap between the highest socioeconomic quartiles and the lowest over the last 20 plus years. And I think this data, while we don't have it in this slide, this trend continues up until present day. You can see that also in terms of spending in schools around out-of-school time opportunities like sports teams. So slide 25 shows spending by sports teams. 26 shows expenditures by family around some of these enrichment expenditures as well. And you can see the differences in those graphs is extreme. So while we have this skewed access to opportunities, we also have, we know that children living in poverty are more susceptible to ACEs, which I'm sure this group knows something about, but adverse childhood experiences. And you'll see here that the red is families that are 400% of the poverty rate, and the blue are lower income families. And again, you can see the disparity in terms of the incidence of ACEs by income level. Our next slide, number 28, talks about the support and opportunity gaps around nutrition, mental health, and health services, and shows just a national perspective here. So this is a piece of our agenda that looks at disparities around health access as a part of our theory of action. So just to remind you, as we think about the needs of kids, it can't just be about schools. We know that kids who come to school with a toothache or can't see the board aren't going to be able to do well in school, or frankly in sports or other aspects of their lives either. And so this issue of access is of vital importance. We also know that the country is changing in terms of demographics. Slide 29 shows the demographics nationally, and that as of 2014, which was now more than half dozen years ago, fewer than half of our public school students were white. So the ethnic and racial demographics of our public schools are also changing. So in this moment of changing demographics, of growing income inequality, and now with the pandemic and growing national awareness around issues of systemic racism, we really think that while this crisis is causing tremendous amounts of pain and suffering nationally, it's also a moment of opportunity. And here at EdRedesign, we see this around the issue of how we interact with kids and how we keep track of their needs, their interests, and their well-being. And we call that success planning. So we've got a number of pilots going in our By All Means communities nationally, of which Matt Buckman in Southern Illinois are a part, have been working on this idea of universally creating success plans for all students that importantly includes a navigator. An adult navigator who's connected to children in each of the communities. Slide 31 includes a long quote from our founder, Paul Rebel, that communicates some of the ideas around success plans and what it means in this moment to provide support to students as they really navigate these turbulent times that we're in, and the fact that having each child connected with a caring adult in their community to help them through these emergency situations, to know what their needs are, to know what their interests are, and to help connect them with those opportunities is really going to be vital as we face probably the most disruptive and unfortunately likely to include a lot of change over the course of the year. Even this navigator role we see as a kind of like a life raft for our kids as they navigate these waters. Slides 32 and 33 give more detail about what we mean when we talk about a success plan and some of the essential elements, and I'd be happy to take some questions about that, but I think I'll move ahead, and rather than going through each of these additional slides, what I'd like to do is move down to slide number 48, which talks about kind of the reach of our fieldwork. I'm going to talk a little more about by all means, and then I think I will pause for some questions and reactions before I ask Matt to talk a little bit about Resilient Southern Illinois and the work there. So as I said, we engage in fieldwork with communities through actually 3 networks. On slide number 48, you'll see a map that includes our by all means communities in blue, and our local Children's Cabinet Network communities, which are highlighted in yellow. For the last 4.5, 5 years, we've been working with our by all means communities as they've created cross-sector collaborative teams, working in each community to coordinate services for students with this vision of a personalized system that includes education, health, as well as out of school time. In our urban areas, that includes leadership from mayors, but as we've got to know and work with more rural areas, we know that mayoral leadership and the local leadership looks different in some of our rural locations. We have a lighter touch group called the Local Children's Cabinet Network, which we provide a lot of support virtually. We'd welcome anyone on this call who'd like to join that to reach out to us. We'd be happy to invite you to that group if you have an interest. Works on the same idea of cross-sector collaboration on behalf of kids within communities. We work mainly with that group through webinars and an annual convening, whereas by all means, as I'll explain in a minute, has been a twice annual in-person convening at Harvard. So with that, I think I'm going to move down to slide 51 that just pulls out in particular the by all means communities, just to give you a sense of where they are. We've got 2 communities in California, Stockton and Oakland, California, 2 in Illinois under the umbrella of the Partnership for Resilience, 1 in the Southland region, and then the other in far southern Illinois, the Resilient Southern Illinois effort, and 2 in Massachusetts, Salem and Somerville, Providence, Rhode Island, Louisville, Kentucky, Chattanooga, Tennessee, and actually our latest community is missing from this slide, but it's Poughkeepsie, New York, that we just recently added. And these the by all means communities, if you look at slide 52, you'll see us pre-pandemic when we actually could be together and stand next to one another and enjoy each other's company. We would bring teams together twice a year, fall and spring, teams of about a dozen senior leaders, including mayors and superintendents, to hear national experts, Harvard faculty, and to build camaraderie among the communities in a community of practice. If you look at slide 53, you'll see just some of the pieces that I just mentioned, led by mayors and superintendents, as well as other key municipal and community-based leaders. These teams, we call them children's cabinets, that work locally to support this cross-sector collaborative work, a big piece of which has been success plans that I explained earlier. So with that, I'm going to take a breath. And let me pause and see if there's any clarifications or questions that I could give folks. And while I take a look at the chat box, maybe I could ask you, Matt, to talk a little bit about the Resilient Southern Illinois work, which we've got a few slides here that are featured.
Sure, certainly. I'm happy to do so. Thank you very much, Bridget. And just a little bit, as we're talking about Resilient Southern Illinois that's in Southern Illinois, that particular initiative is including about 16 different counties, around 18 school districts, and we've had different number of districts involved at different points throughout the process. All of these districts really were calling for and wanting more information and understanding around the effects of adverse childhood experiences, the effects of poverty, the effects of the really the gap between those individuals that have and those individuals that have not. And so very much we've seen this time and time and decade after decade of the rich get richer and the poor get poorer. And then we would have small things that would pop up. We'd have collaborations that sometimes it was hard. Sometimes even we burned bridges around bringing in certain providers within the school or trying to partner together on certain initiatives. So really looking at ways of how do we create this system of care? How do we get these multiple types of disciplines and multiple perspectives and sectors all working together in the same direction? And we've been very fortunate. We are very happy to be part of this By All Means initiative. But a lot of, we have higher rates, 2 and 3 times the rate of the rest of the state and nation for children who've experienced abuse and neglect. And within that, our system within our state for child welfare have had different struggles, and especially struggles on turnover and being able to create that continuity. We have 2 kids that are in foster care system for too long, and any number is too many, but too many individuals that end up being hurt in those systems. Really looking at how professionals and a specific title, discipline, organization name will not be the solution, that it really has to be a community solution. And so looking at how do we have our schools really take the lead in that. And so we have some schools that are doing student success plans. We have schools that are focusing on how do we care for our own staff. And during COVID-19, we do have to take care of ourselves during this time, and you can't pour from an empty cup, so to speak. But also how I care for me is sometimes how I care for other people. And each school got to have, or each district gets to have their own local grown initiative and goals and objectives and strategies. And so we very much are fortunate. But during these rough times, we are so glad that we already had the infrastructure together to be able to support each other and bounce ideas of like, hey, what's school going to look like for you? And what are, because we may have all the same state entity that's going to tell us kind of this is what the recommendations are. But we've got one school that has started a summer program, and it's even a pre-K summer program with busing, and some schools that we're not really sure what it's going to look like next year. And so being able to support each other and create this community has been very valuable. I don't know if that's okay with you, Bridget, if there's any more. Cool. All right.
Oops, that's fabulous. Thanks so much, Matt. Yeah, and just to reiterate, what part of the reason that we engage in fieldwork is, of course, to try and make a difference in the kids' lives and through supporting local folks doing the work, but also so that we can learn from best practices in each of those communities. And so we have a number of resources that you can find on our website, which I'll put in the chat box in just a minute, that are available to folks that kind of digest some of these best practices. We have a toolkit for how to create a children's cabinet. We have some information about success plans. So I'll include some of that when I hand it over to MK. But let me pause there and see if there are questions from folks. If there's pieces of what I've just presented, I just fired a lot of information at folks. Things that resonated, questions that folks might have about what was presented.
Bridget, if you don't mind.
Yes, please.
So I'm working with a community that's talking about putting in place not just, they're trying to get in on the front end of building resiliency. Looking at ACEs and being trauma-informed, but trying to go a step in front of that and sort of proactively building resiliency within children, or literally starting with the pregnant mother and working through. And so I'm just wondering, have y'all had experience with that sort of an approach, or do you know of communities that are working in that way?
Yeah, so thank you, Shannon, for that question. And I think one of the slides I skipped over, number 41, is a slide we adapted from the Forum for Youth Investment that talks about an insulated pipeline. And this idea of preventing the trauma in the first place, of course, is what we all would aspire to. And so many of our communities are working on creating this insulated pipeline that starts, this example here is early childhood, but even prenatal is some of the work of some of our places, a 2-generational model where they're connecting families and families to be to services in their community. And some of the places that come to mind immediately are some of our more urban spots, but MK may have other examples that she could speak to in a second. A couple of the urban examples are, one is in Oakland, which has created childhood savings accounts. So when children are born, there's been research that shows that if there's a savings account linked to higher education, savings for higher education, or for post-high school certificate training, that kind of thing, that helps to promote a lot of the connections to these services and kids' well-being in the long run. So we have a community working on that. We have a community in Somerville that's created a system to, as soon as a child is born, to connect them with the city services through home visiting practices, as well as a database that kind of keeps track of kids so that they're not lost between services before they enter the K-12 system. So those are a few quick examples. Okay, so MK, maybe I'll hand it to you now, and I think some of what you'll share is going to be very interesting for folks because it's all rural-based.
Sure, yeah. I'd say one thing to add to what Bridget was just saying and to Shannon's question as well, there's organizations, I think, across most of my familiarity is the rural South, but in rural areas, there are a lot of nonprofits doing things like nurse visiting programs, et cetera, that work on the prenatal side into helping families adjust with young children. So really thinking about that from both a developmental standpoint, a nutritional standpoint, et cetera. And I do think it's interesting, if the point has not yet been made, that there really is such a deep connection between income and community and aspects of opportunity for a child that can impact the development for that child. And so it will pick back up, it will feel like deja vu for some, where I was talking about the really staggering idea that, or startling idea that we have a lot of students sitting in rural classrooms across this country, and we still don't have a lot of policies or organizations working to bridge the gaps between systems in the same way. So in slide 61, there's some data here. It looks at 1 in 5 students in the US attend a rural school. 53% of school districts in the US are rural, and 28.5% of America's public schools are rural. So a huge number. And you look at that by state in slide 62. This is looking at some of the states the most. So my home state, somewhere down closer to the bottom of Missouri, and that varies based on where people are located. And I think one thing to be really mindful of is that when we think about ACEs and we think about the compounding factors that can impact outcomes for children, we'd be missed to not speak about racial inequality in the country, and specifically racial demographics in rural areas. And so here we see that while oftentimes there's a bit of a narrative that rural areas are poor and white, I think is a bit of a trope. And it's widely assumed to be white, but the assumption is inaccurate for many rural places and people. So slide 64, nationally 9% of rural population is Hispanic, 8% is African American, 2% is Native American, and about 1% is Asian or Asian Pacific Islander, and 2% multiracial. The remaining 78% is white, and these demographics actually really differ regionally. So the Mississippi Delta, for example, you'll see in the teal color, the Mid-South, it has higher proportions of rural or African American communities. The Rio Grande Valley in South Texas has larger swaths of Hispanic residents, and rural Native communities are found across the Great Plains and Alaska. And these demographic patterns reflect long histories of oppression and exclusion, and the removal of tribes from indigenous land, the enslavement of African peoples, European conquest along the southern border, and also some recent trends of segregation and immigration. And I think that those are important things to remember as we think about moving to a place of having connective structures to impact and improve outcomes for children in rural areas. Second on that topic is the idea that we know, Bridget really underscored this point, that poverty is so incredibly linked to so many different potential outcomes for young children. And we think about rural poverty. Here's a breakdown looking at high poverty rates. And then in slide 66, if you see persistent poverty, so persistently poor counties are classified as having poverty rates of 20% or more in 1990, 2000, and 2010. And using this one metric of persistent poverty, there are 429 persistently poor counties in the US in 2010. 86% of those persistently poor counties have entirely rural populations. So if you let that sink in, thinking about these counties that have multi-generational poverty, which I think strikes differently when we need to think about policies that can help leverage, improve outcomes for children and families in the area. Obviously, that poverty trickles into schools for the students who attend the schools and where they live. In slide 68, you'll see that there's a lot of challenges facing rural communities that happen outside of the school. People in rural communities are 2 times more likely to overdose on prescription painkillers than people in larger areas. 45% of rural adults report being directly impacted by the opioid epidemic. Rural areas have more frequent occurrences of diabetes and coronary heart disease than non-rural areas. 13.1 physicians per 10,000 people in rural areas as compared to 31.2 physicians per 10,000 people in urban areas. So we have significant physician shortages, we have hospital closures, and we have lack of access to healthcare, which I'm sure is nothing new to the members of this group. Slide 69, we think about the challenges facing rural communities at the family level. So more than 60% of caregivers in rural areas with a report of child maltreatment experiences highly family stress. 1 in 3 rural families reported to CPS have trouble meeting basic financial needs. That's thinking a lot about that persistent poverty. Rate of abuse is higher. 26% of rural children live in households below the federal poverty line compared to 21.5% of the urban counterparts. So a lot of and of course, 27% of rural counties do not have a social worker. So thinking about a lack of infrastructure to address a lot of these challenges and thinking about needing solutions. I think it's easy to think about the deficits of rural areas. I think one of the most beautiful things about rural communities like the one I'm from is how deeply integrated my community is, because there are fewer people, many people wear many hats. And I think that natural connectivity is something to really leverage in situations like these. And I think that having a formal way to move that forward, like a children's cabinet or the work that's happening in Resilient Southern Illinois, can really create the longevity that's necessary and underscore the sustainability aspect, because people are going to burn out if they're wearing too many hats and doing all of this work. And I think that kind of pulls us back to looking at slide 72. Beyond the challenges of rural areas, we know that they're more likely to be persistently poor. There's less likely to have economic development in the region. So there's not a lot of businesses, jobs aren't as frequent. And we also see that there's a decreased amount of philanthropic spending. So slide 72 really focuses on thinking about the majority of places where people can apply for grant funds, et cetera, are in urban areas. And so slide 73, looking at foundation grants to U.S. rural-based organizations from 2005 to 2010, 5.5% of the real value of grants by large foundations, 7% of the real value of grants by small foundations, 19% of the U.S. population lived in rural areas, and the funding just wasn't there in terms of how we can apply. And so this brings us to some of the work we were doing at the EdRedesign Lab. You'll see on slide 75, we have a rural working group, not dissimilar to this one, where we brought together groups of leaders from rural communities who are superintendents, both current and former, psychologists, educators, executive directors, social workers, researchers, healthcare professionals, and they represent a large swath of backgrounds within K-12 education, after school, teacher development, higher ed, and so much more. And this group of professionals really came together to think about this year in particular, how we can address certain issues that can come up in rural areas and really improve outcomes for children. And of course, when COVID-19 occurred, started really recognizing the lack of resources for rural communities, thinking about access to accurate medical information, access to the internet, access to specifically thinking schools. Rural communities were less likely to be able to go completely virtual classrooms. So what did that mean for printing out worksheets? How were teachers getting things to students? How were families getting them back to teachers? And so we worked together with this group to create the Rural Community Resource Hub. And so you can see a little bit about that on 76 and 77, and I invite you to visit it yourselves. The link is included in this presentation at sites.google.com/view/rural-resource-hub/home, where we have a lot of 4 different buckets of information. So the first is for families and students. Some of those advice for parenting, especially when everyone is transitioning to being home due to the pandemic and their children are home as well. Maybe both parents are working, etc. So some parenting things there. For schools, educators, and districts, especially thinking about as we go into this reopening phase, how do we do this in a way that we're doing no harm and really trying to improve outcomes for children. Community highlights of rural areas who are doing these things very well. And then, of course, accurate health information and resources. And so that's been a little bit of our response specifically to the current context as it was. I'll hand it back to Bridget. Bridget, I think you are on mute. While Bridget figures out the mute situation, if anyone has questions or
I think we did have one question very early on when we were first asking in the chat box, and it was specific to that question around, I'm looking for it, but it was specific to, I think, as schools are opening back up with the virus response, you know, how they can best support kids in poverty in rural areas. Here it is. It says, hoping to learn how to best support families that live rurally, and specifically they're talking about New Hampshire and Vermont, in the process of schools reopening, and in that process, transportation solutions, and that situation in general with COVID-19, COVID distancing. So
I think that's a great question. I can take a stab at it first until Bridget figures out the mute situation. One thing I did kind of glaze over, and it's on slide 71 of the PDF that was sent out for people's use for viewing. One thing that is really particular, so when we talk about solutions that aren't centered around rural communities that are trying to be implemented at maybe the state level, is oftentimes overlooked, is that the transportation cost for rural schools is significantly higher than it is for most urban schools. And especially when we think about plans for reopening, those costs are going to be really important to think about in terms of getting students to and from school. And it's an additional cost incurred where the spending is lower. So where we spend about $11,000 on average per pupil per year in schools across this country, in rural schools we spend on average $6,000. And so thinking about we're doing more with less financial capital, which is going to be something that's really important to think about. So it might be strategizing around ways that we can either improve expenditures or connect with the private sector to figure out how to meet somewhere in the middle to make sure we get our bases covered in terms of reopening for rural schools.
And are y'all doing anything I mean, we anticipate the mental health effects on children and youth coming out of this to be pretty profound. And I'm just wondering, are you convening anything particular around thinking that through with the communities you're working with?
Yes. Okay. It looks like Bridget asked me to share something. Yes, to your question, Shannon, that is something that is being deeply considered, really thinking about not only the mental health of students sitting in classrooms, but the family is thinking about how they're going to, if you're worried about someone in your family having the virus or getting the virus, or what a virus is for students, not to mention the other compounding effects of being out of school. So maybe you weren't around your friends, maybe you weren't able to do the things that you were previously able to do, you didn't have your same creative outlets, maybe you didn't feel as supported specifically around those things. So I think that there are definitely pieces of toolkits being developed to help support that. And specifically, one thing that we're thinking about is trying to create in the Rural Hub a bit of a guide for school leaders and district leaders in rural areas, because a lot of the evidence that's coming out are certain things like the American Academy of Pediatrics putting out a guideline for reopening or events happening. But what's interesting is that a lot of those are missing the rural communities. So if it's a guideline that's kind of one size fits all, it might not be a guideline that's still applicable for that same community. And so we're trying to find resources and aggregate them for people who are making really difficult decisions about how to make sure that we're keeping kids safe, but really bringing them back into the fold of the education system. So when a guideline comes out and says, well, you can do 1 week on and 2 weeks off, for example, well, how will that work in a rural area that doesn't have the same access to broadband and doesn't have the same access to a virtual classroom opportunity? I'm really thinking about, we actually need to create something that can be sustainable for rural schools and rural communities as well. And so really trying to point district leaders to resources as they wrestle with these questions.
Thank you. So Bridget put in the chat box, MK, could you share the reopening page on the Rural Hub?
Let me see if I can link that if people are interested in seeing.
Oh, she just posted it, looks like.
Okay, great. So if people wanted to check that out or check the hub out. And we're also really interested in, if anyone has access to information, we're constantly updating the hub, and anyone who might have information of how we can better support district leaders or how we can better support parents or relevant health information, any of it, if you have something and you want to send, we'd be more than happy to add it to the hub.
Okay, I'm sorry for all the technical issues. Can you hear me now?
Yes.
Yeah.
Okay. Sorry, I don't know what's going on. But yes, that's exactly what I wanted to point folks to, MK, because that is, it's not really the work that we're doing is aggregating all of the good work of other organizations with the expert help. And I think you said this of Maura Teagan, professor at Bates College, who is the author of Why Rural Schools Matters. And she is an excellent expert partner with us, helping us put this resource together. So I would recommend that to everybody. And as an organization, hopefully in the next couple of weeks, we will have a kind of digested, did you already mention this, MK? I may have missed it. But we're going to have a digested list of some of the most current relevant pieces of public health information specifically tailored for rural communities, and we'd be happy to share that with the group as well.
So Matt's posted a question to the participants in the chat box that says, collaboration with diverse groups and sectors can be challenging. What strategies have you all seen work to reach collaboration? So I would invite any of the participants to give us some feedback on that. Christina, I know you've had some experience in trying to work with education from a parent perspective and a family-run organization perspective, and sometimes that can be challenging. I mean, in my own experience, I've seen that. So I don't know if you want to weigh in with anything.
I really think that the main challenges that happen are that administrators seem to be cutting families out of the discussion when it comes to inviting students to re-enter the classroom. And I mean, I understand that they have to make plans that comply with their needs, but like we had mentioned, what do you do when it's one week in school, 1 week out of school, and you don't have access to the internet, or you don't have access to a printer at home? So I really think that that's challenging. The other challenge that I know our rural communities specifically have are that many children are being raised by their grandparents due to the opioid epidemic.
Mm-hmm.
And so often that then compounds things because we have children living with that high-risk population who may also not be as tech savvy as we might like in a situation like that. So I'd love to hear if anyone in our audience has had any experience. I know that in our community, schools are beginning to send out questionnaires asking families what they think, what they need. If anyone, any of our participants have had experience with those surveys, putting them together, or has been able to see any of the feedback from those services, that would really be interesting to me to hear about.
Anybody in the attendee section have any questions or response to Christina's question, or any feedback to our presenters? Or have we missed the challenges that you're facing? You know, what is it that's most keeping you up at night and that you worry about and struggling to figure out a response to? I know it's a difficult time and things are so different all over the country in terms of the current COVID situation. Things are reopening at a very staggered approach. Things are not really resurging, but continuing to surge at different rates around the country, and communities are responding very differently. We did get a comment back in the chat box from Lisa Whitley saying, I work in the Community Mental Health Center in South Dakota, and we serve the Rosebud Indian Reservation, which is the second poorest county in the nation. Telehealth has been a very good pathway to making connections with the school kids. Once they return to school, we are looking to put video equipment in some of the schools to keep this going without face-to-face contact. That's interesting. I mean, we are, you know, as we're working within the TA network and with others, you know, as innovations are coming online, you know, out of necessity through this crisis, we really are looking to try to capture those to see, you know, what we can continue even past, hopefully past the epidemic. So that's a good strategy. And we have heard at different times that some youth are actually engaging more with some of their clinical people through technology versus, you know, face-to-face, that somehow that can resonate better with some youth in particular than others.
I can say that in rural Pennsylvania, they're very excited about the opportunity to expand access to child psychiatrists using telehealth services, as well as access to psychiatrists to offer that specialized treatment maybe for our LGBTQ group of students, or for some of the lesser known or less common mental health challenges. So that telehealth option is something that we're really excited about. That's, I guess, a good thing to come out of the negative.
Here's another comment from Cheryl Williams. She says, in terms of things that keep me up at night, the lack of research regarding youth who have been born positive tox for opioids, born with opioids, and whether our schools are ready to provide education to these children. I mean, that's a terrific, I mean, are y'all thinking about those things, MK and Bridget? I mean, that's certainly a rural issue right there.
Yeah, Cheryl, I think that's such I was just thinking it's so on the nose in terms of issues that people are thinking about in education right now. I also think that this is where the utilization of something like children's cabinets can be really useful, as we think about the circumstances for children who are born with the opioid epidemic, specifically those who are born, and the types of developmental needs that they will have, thinking about those programs starting the prenatal care we originally talked about. So how are we going to integrate a system that's really prenatal to the school to have something set up, because I think that the needs would be, you're right. I think that we need more research on it, and I think that there's going to be a diverse set of needs presented, and that it won't always present in the same way. And so really making sure that we have something to wrap around to support communities starting at that prenatal phase is something that the education field has to begin thinking about.
And I would agree with everything MK mentioned, and add one of the things we are thinking quite a bit about that's not exactly related to this question, but brings to mind for me is the added responsibility on teens in this moment in many families for childcare or for contributing economically to their families, and in some cases at the expense of their own learning time. And how can a community think about lifting some of that burden off of our teens so that we don't reinstall, generational disadvantage? So that is something that we're actively trying to think about as well.
Well, I'm certainly looking forward to getting on the Rural Hub website and keeping up with that, and would really encourage, the other attendees and participants on today's webinar. I mean, again, with us kind of stepping back and formally organizing and supporting this group going forward, I think I'm grateful to have that to look to kind of keep us informed. And again, we'll try to share things within our learning platform as well. Maybe we can, Sarah, download some links or somehow make sure that that's ongoing access to that site is available. So, well, are there any other additional questions that we have from any of the participants or comments? Matt, did you have anything else that you wanted to make sure we attended to?
No, I appreciate Bridget and MK sharing your expertise and knowledge today. And honestly, there's a lot of facts and things that I'm going to hang on to from your handouts for a long period of time. And so really looking at maybe now more than ever, we may need more supports for rural communities. However, during times of crisis, and I love the kind of mapping out of funders and things like that, during times of crisis, oftentimes we kind of pull in closer, kind of keep our hands closer or our deck closer to our chest, and pull in closer to just focus on our own communities. And many of our rural communities get left out in that picture. So we appreciate the work you all are doing, and keeping in mind all of us small towns and small cities, even though some may not call us cities, all over America, and that our kids matter too. And our communities have diversity and have challenges, and we have to step up to the plate for those. The slide that's up right now is just Bridget and MK's email addresses that you can reach out to them if you have any further questions. Please make sure that you download the handouts from the chat box. And just to note that there's an underscore between Bridget and Rodriguez and MK and Montgomery, that there are underscores there, but you can email them. You also can email Shannon and Christina and I as time goes on, and we will continue to try to look for the right resources to be able to help out. There is a feedback survey that's been posted here before we move on, but there's also a question, Bridget or MK, if you guys want to address that, if y'all can see that one.
Well, so this one from Katie Williamson.
Yes.
Yeah. Well, I think she's sharing information here, right? We've partnered with our local OBGYN.
There you go.
Referrals for moms who are maybe using substances during pregnancies. So this is, a strategy for prevention, which is this two-generational kind of approach, I think, is one that we see as vital. So thank you, Kay, for sharing that. And I'll just say thank you for inviting us to be here, Matt, Sarah, and Shannon. And, as I said, we're learning and just eager to be in touch with any of you that have resources to share. The Rural Hub is really the hard work of MK, and it's an incredible resource. So please do take some time to take a look at it. MK, any last things you'd like to share?
Just echoing your thanks, Bridget, and thank you all so much for your time on this Friday afternoon, and I hope everyone has a wonderful weekend.
Thank you. Thank you both
Thank
so
you.
much for all the information. Thank you.
My pleasure.
Happy Friday, everyone.